I'm very excited to be here. Thank you very much for inviting me and describing a piece of my research program to a population that's very dear to my heart, young adults, adolescent young adults. Today I'll be describing an intervention that we just recently closed. It was an RCT and... Oh, yes, okay. What's that? Okay, because I speak very loud, that's why. So today I'll be presenting that program, but just giving you a feel of, Brett talked about rare diseases, and I think that unfortunately cancer is not a rare disease, but it is a subpopulation of the cancer population. So I'll be giving you a glimpse of what their challenges are and how I really came about to currently study this population, but really, like Brett said, let's do something for them and what is existing out there. So who are these people? So there's actually 4 core groups who are studying this population, and the problem that we're facing first and foremost is their age, the age range. So the 15 to 29 is the Canadian one, the 15 to 39 and the NCI one is the American one, and then the Brits have a different age category, and then the people in Australia have a different age category. And as you can understand, their developmental challenges and how they will approach and survive this illness will be vastly different. But let's start with what we have in North America. And to give you a glimpse, it's still a minority of patients, thank God. And the really good news is that they have an 85% survival rate. So this is on the upswing. However, when you're surviving a disease like cancer, it's not only the psychological, but it's also all of the biomedical treatment side effects that you are dealing with on a long-term basis. So needless to say, this is a population that will need help for their unique needs. And when I looked at the literature as to what is out there, because you have, I would say 90% of my clinic currently at the LG-POP at the Siegel Cancer Center across the street is young adults. And the majority of times they tell me, I come to you because there's really nothing out there for us or specifically for us. And their needs are really underserved. So what are those unique biomedical? Well, first of all, Dr. Baptiste and a team, Dr. Cavan, we have an AYA special clinic. It's the only one we have here in Canada, and it's right here at the Jewish. I'm part of this clinic. It's the McGill Adolescent Young Adult Clinic, and really looking at the multidisciplinary type of approach to treat these patients. And on the biomedical side, what we're looking at is, of course, tumor markers and response to treatment. And we're really now delineating some very particular markers which unfortunately, fortunately, unfortunately, because right now the biggest issue is that these patients fall between 2 chairs in terms of clinical trials that were either designed for children or for much older adults. So there's really this gap. So the more we can come up with these various biomedical markers and response to treatments, then the more we can enroll them in clinical trials. Just an example. Young adults respond or recuperate much faster for invasive treatments like chemo. However, the clinical trial calls for a specific dose, and you can't augment the dose. Obviously, it's a trial, but it's a problem if you're a young adult and you want to either participate or you can respond to a higher dose. So we're really there's a lot of struggles in terms of the clinical trials. The other thing is, like I said, there really are, in some cases, permanent, irreversible treatment side effects. If we look at the biggest one, infertility, that these young adults have to live with for the rest of their lives. And as young adults, obviously, when you're 20, you're 30, you don't have a methodology, what I call the methodology about illness. You're diagnosed. Who do you turn to? You hear these things for the very, very first time. In terms of psychosocial challenges, well, I guess what you can, I mean, there's a lot of young adults in the room. I guess as you can understand, this is a complete arrest in your life. And this is really a time in your life, as you can understand, the emerging young adult and the formation of the self, and really the reaching of those milestones, not only graduating, but getting into a significant relationship, and really parting from your family background and establishing yourself as a young adult. Very, very key developmental issues that suddenly there's this interruption. And for a lot of them, it's not an interruption that's about 2 weeks because you're getting a surgery. But if we look at, for example, for the BRCA population, the breast cancer population, these young women go through these treatments for about 2 years. And if it's a hormonally receptive type of cancer, it's 5 years of additional hormonal suppression agent. So this is a long time to live under this cloud of cancer. And so we really need to help and support them. And the other things that I'm looking at is the relationships, because as the developing self, you are emerging as an adult, you're individuating from your family, but you're also forming very significant relationships. So family-wise, I looked a little bit closely at what's happening. And the most obvious one is the parental regression, is very obvious. Again, I hate the cliches, but this is what I hear a lot in my clinic. Parents become the helicopter parents, and the 20-some-year-old becomes the child again who's dealing with an overprotective parent. These are some of the things I read in the literature and hear. Socially, lots of disconnection. A lot of my young adults say, I have great friends, but they just don't really understand my reality. It's such a different reality when you're stuck with this illness. And of course, missing all those social gatherings and opportunities. Sexually, because one of my training is sexuality, there's a lot of issues there, mostly regarding the treatment impacts, really about not only the plumbing, but also about their body and self-image. And really lacking in this sexual experimentation, which is so key and essential to your sexual preference and orientation, and finding also a partner. In terms of the couple relationships, the research that I found pertaining to young adults is really the testicular and cervical, which are most at risk of relationship loss. And of course, as I said before, there's important delays to establishing this milestone of finding a meaningful partner and also starting a family. Why they're unique? Well, the Gen Y, they use technology. This is what I found. And these are statistics which are going to grow more and more as we look at the reports. So this is speaking to me, and what I thought about, it's interesting because, just a little side note about Skype, the idea came not only as a population, but also because parking at the Jewish is a nightmare. And you know, a lot of them, I mean, it's funny the way you come about research ideas, right, Phyllis? I mean, you think about those things and you go, yeah, why does he have to come to the Jewish? And then I remember this colleague, when I got hired, I was 1.5 years waiting for an office, right? My colleague, Dr. Nero, knows all about that. And Phyllis was grateful enough to give me this little office in the ICFP library. And right next to me, there was this gal who was doing her fellowship. And she was doing an intervention via Skype with some subjects in Argentina. And I said, oh, that's really interesting. So I put 2 and 2 together, no parking. Or if it's not the parking issue, is I'm really not feeling great, Dr. Aubin, to come into the Jewish. Hey, Skype. And it falls right into their habits. So then I looked at, okay, what is out there for these young people? What are we doing or not doing? Because you remember, there's a lot of unmet needs. So essentially, I found 5 RCTs, and just giving you a glimpse of what I looked at in terms of designing my own project. This is in your notes. I'll just go a little quickly to say that these interventions were they were delivered face to face and person to person. And they really were, except for one which really focused on sexuality, they really focused on general coping skills. Most of them were group types of intervention, and their number of sessions varied. Now I looked at the internet because, as Brett said, you know, the internet is the most, I think it's the big, if we look at psychosocial interventions, especially, I don't know about other domains, but in oncology, because of all of the limitations I've talked about, this is the modality of intervention en devenir. And what I found specific to young adults is 2 interventions, which I was a little surprised. One was about a video game. And you have to remember that these are RCTs. There are some intervention-based types of program, but these are the only 2 that I found for young adults. And the other one is a physical activity program. Now, what's interesting is, again, the video game is looking at, it really is in a population of what calls to them. And really the program, because the last young adult meeting I went to was really about more medication adherence. Because when you're dealing with the younger one, the adherence to treatment and recommendation, medication and thing can be a problem. So this program targeted that. And the other one targeted physical activity. I looked at Skype. I said, what about Skype? Specific to Skype. Because an internet program, there's various things. And I included an article in your package that really surveys, fait un survol de all of these interventions. 2, none in psychosocial oncology, so it looked like I was the first one to do that in oncology. And what I found were these 2. And I looked at, okay, well, what's the modality? How many sessions can you, because the biggest question I had when I wanted to provide Skype intervention is not only in terms of, you know, the therapeutic alliance, but the biggest thing is feasibility and recruitment. And also, how do you adapt a content, your dialogue, your style to Skype? I had never done Skype intervention. So apparently these guys got like pretty good results. Results particularly the in-person as opposed to the Skype, because that was my biggest concern. Am I going to have, you know, an effect with the Skype as opposed to the in-person? And apparently these guys got between effects in pre-post. There was only 1 RCT, and the other one was more of a parenting program. So in short, this is what I came up with, the guidelines and what I should be doing. And I have 5 minutes left. I can't believe it. So I came up with this program. And the reason is that I looked at the research, but I also listened to those young adults. And 3 themes kind of emerge. 1, dealing with the cancer stuff, which I'm not used to, which is a shock. And significant others, how do I deal with other people around me and their emotions? And 3, sex. And these were going, this is an RCT, and they were going to be randomized to our famous care as usual, or to the intervention. And the intervention was going to be delivered either Skype or in person. And this is really, was based on the subject's preference. So the first one I called Boxing the Cancer really means boxing in 2 ways. Boxing the cancer and boxing, compartmentalizing. Because if you're going to live with something, you really have to compartmentalize this. So it's really teaching them. It's a really basic coping skills, problem solving, decision making. Important component, and I'm happy you asked, Vivian, because these guys are very isolated. So providing them with the network, AYA-specific network, was part of this program, is to let them know that there's websites, there's things that they can do to connect with other young adults. The other session was, hey, it's still the same me. It's really looking at the emotional impact of cancer, but really from the perspective of what am I going through and what my significant others are going through. And it's things like setting boundaries with the family, connect or disconnect with people. The sex is really looking at fertility. These are questions and things that most often I hear. Dating for the single AYA, or for the one who's coupled, really how to maintain healthy relationships. We had a part about sexual plumbing, what I call my sex toys, and it's really for them the first time they hear about stuff. And then this is the intervention. So as I said, it's a mixed design of a post-interview that these are the results that I'll be presenting today. I have quantitative data as well, which are questionnaires. And let's look at some results. So I was astonished. We had 117 participants. Who they are? Yes, most of the times it's young women. And in the oncology, a lot of these young women are breast cancer survivors. Most were coupled, and majority no children. And where they were from, I was really happy to see there was one from Finland. And the reason is that Young Adult Cancer Canada, which is a specific for young adult here based in Canada, posted my ad, and this is read from all over the place. But I got quite a few people from Toronto. Now, the first question I asked, is this feasible? Well, this grant I got from FRSQ was a 3-year grant. I projected 60 participants. I got 117. It was like, wow. So a little bit like Brett said, you know, people are excited when there's practically nothing for them. So I think this is why they participated. How they participated, those that were enrolled completed all the 3 sessions, a majority of them. And this is the breakdown between the Skype and the in-person. And looking at the reasons why we lost them, I was a little concerned. Is it, you know, am I going to lose people in Skype? And as we can see, a lot of my attritions, unfortunately, are, if it's not interested, it's really about disease progression. I have to sadly say that one participant passed away in my study, which was very difficult. Now let's look at, was this relevant? Because I came up with this idea, you know, but you never know if this is going to be what they want to hear about. And it seems that they did cover issues that were important to them. The content was also very appreciated. Was that useful? Seems that it is. And I was concerned about the duration because a lot of them, once they started to disclose, they really wanted to have longer sessions, even though in terms of the number of sessions, they were quite happy with it. And they would really recommend this to other young adults. Interestingly enough, they really liked session 2, really again dealing with their relationships and a strong component of emotional management. And I asked the question in various ways, how is this helpful? Because I haven't looked at my quantitative data again. Excuse me, Till. But these are questions that I came up with in the interview, and it sounds like it did provide them with strategies. And the one about feeling less isolated was encouraging, because this is really what my biggest hope was, at least we'll have a connection, they'll be heard, and they'll hear stuff that are really relevant for them in a way that was meaningful. So the conclusions is, you know, we just closed enrollment to this study recently, so it'll be interesting to see what the quantitative versus the qualitative. And this is really the beginning for me. This was really a feasible study. The Skype sessions were great. I did not experience any, because, you know, you may say, what about technical difficulties with the Skype sessions? Did you have a lot of communication? Not at all. And as we are advancing, the technology is better than better. It really is a portable intervention. It's interesting. I had a few participants on their lunch break hour from work going into a room and Skyping via their phone. So I think this is where the future is in terms of interventions, certainly in oncology for the parking is one thing, but you can imagine when you're a young couple with young children, because they are young children, they can't come to the Jewish, whether it's the Jewish or anywhere else, or whether they're... one thing that I just want to... I skipped it, but what was interesting is in the disease trajectory where these people were. And it looks like it's more people were done with treatment. So it's always interesting because one question I had is, when are these patients most receptive to receiving this kind of intervention? And it's really consistent with my clinical experiences. When I'm done with treatment and I'm supposed to be, okay, you're done, have a nice life, as Dr. Néron can, this is when things really hit them. A lot of them. It's like, well, what about my fertility now? What about work? Where am I going with this? And the biggest is, what if it comes back? What am I going to do? So thank you so much. I welcome your questions.